Okay, this is the leg that I showed in the testimony yesterday as to how he had come earlier and how the changes were after the first dressing with GoHeal. So, because of a lot of people had asked me as to how the dressing is done, here we go. We first wash the complete limb with sterile water. And now we will put povidone iodine solution scrub the entire limb, and we give a thorough wash. And as you're giving the scrub, gently, without hurting the tissues, we have to keep cleaning the leg. And then we will once again clean the limb with sterile water. If you can see here, he's got a post-prebiotic wound because of varicose vein condition. Gently put a little bit of antiseptic solution. It could be Savlon or even Dettol for that matter. And then once again we put sterile water and wash the Savlon or Dettol off the limb. Okay, and now with a sterile cloth we will pat dry. I always talk about pat drying the entire the limb or the wound. So this is how we pat dry. Don't rub it, because when you rub there could be damage to the skin. So we just do a pat dry. And make sure that there is no water remaining even in between the toes. Now we will take some GoHeal and apply on the affected area wherever we see the blackness of the skin and on the wounds. And when you see a wound, just make sure that the wound is covered with GoHeal. So you should not be able to see the red tissue. So give a gentle massage so that GoHeal has evenly spread to and around the wound. And if you see certain spots where there is a slight ulceration, just apply a generous amount of GoHeal there. You can see this area. For all the other areas, just a thin film is enough. So now on the areas where we see the little slight ulceration, we will place sterile pads and we will then take sterile roll pad so that the ointment, so that GoHeal remains intact around the limb. And once we have done this, we will use a crepe bandage. This bandage is used so that the blood circulation is optimum. So this kind of bandaging will help the wounds heal faster. Okay. So ensure that you put pressure while you are putting the crepe bandage, so that there is enough elasticity around the foot. And once we have done this, just clip it, or you can put a tape around it. And this will remain intact. You can either put it completely, or just a piece is enough?